Blue Shield says, pay or die.
Cynthia Campbell has been a recovery room RN with more than 30 years experience. When she was dropped from her Blue Shield policy after being diagnosed with 2 rare and aggressive stage 4 cancer, she ended up with $800,000 of medical bills until she was able to qualify for her husband's VA plan, which saved her life. If it's good enough for our enlisted, it's good enough for the rest of us.
Companies like Blue Shield, all the rest of them, they've taken healthcare, which is a human right and which was developed by humanity, and they've taken it like leeches to suck the lifeblood out of it. After I was dropped by Blue Shield, my husband's VA program, because he is 100% disabled, my husband's VA program allowed me on, and because of that I was able to continue the care I need. In fact, just yesterday, having the results from another scan, which were perfect. The government health care system that I've used through the VA has been a lifesaver, and it is good. The thought that we need to have companies like Blue Shield to take your money, make it theirs, and then keep as much as they can from the doctors and hospitals is a joke. They didn't discover or develop health care. They're just leeches that are taking everything from our health care system.
This, of course, is a national struggle. We're joined today by one of the leading healthcare activists in the country, the National Coordinator for Healthcare Now. So if I could ask Katie Robbins to come up and greet us.
I'm in town from Philadelphia, and let me tell you, this is not a problem that is only happening in California. People are being devastated across the country. We actually launched a campaign recently to collect testimonials of people who are suffering. It's called, Will You Cry For Me, John Boehner? We're hearing a lot of really, really sad stories. I encourage you to go to that website, sign the petition. If you have a testimonial you want him to hear about, we pledge to read every single one and deliver a tissue with each story. There's also an epidemic going around the country. It's just been diagnosed as PIISD. PISD stands for Private Insurance-Induced Stress Disorder. And let me tell you, the new law with the mandate to buy private insurance, this problem isn't going anywhere. But the cure is Medicare for all. So what we say around the country is that we want everybody in one public-funded risk pool where we guarantee health care, comprehensive coverage for all. We say everybody in, nobody out. Everybody in, nobody out. Everybody in, nobody out. Everybody in, nobody out. Everybody in, nobody out.
We're here today because we're at the scene of where corporate crime is taking place. The death panels sit upstairs denying patients the care that they need. And as public advocates, we're here to protest against that and try to change their decision. But we know that only by standing together we're going to hold them accountable. This decision, this 59% rate increase, is going to ultimately result in heartbreak, misery, death, pain, and suffering. The bean counters that sit upstairs don't sit at the bedside and hold the hands of our patients every day. They don't see the effects of their policies, their heinous crime of denying payment for care, the suffering and pain, the frustration that causes. But we do. We're the voice of those people. We're the voice of our communities, and we're here to bring accountability by advocating to eliminate these insurers from the system. They do nothing to provide the actual health care that our patients need. Ultimately, this decision is going to make it trickle down to our patients, because if they deny payment for care at the doctor's office, to the labs, to the hospitals. The doctors, the labs, and the hospitals are going to get bill collectors, and they're going to come after our patients. They're going to end up on the street without a place to live. They're going to be hungry because they can't afford to buy groceries. They're going to be cold because they can't afford to buy clothes for their children and their families. So that's why nurses are here today. This is where politics gets real personal for us as patient advocates, because we see the failed politics, the failed policies of an immoral, inhumane insurer such as Blue Shield.
I represent the thousands of hardworking doctors who know that we need to replace this private insurance-based system with Medicare for all. We need a non-profit system that gives us health care. Insurance companies don't give us health care at all. How many of you have ever had care denied by an insurance company? I see a lot of hands go up. How many of those insurance companies have a license to practice medicine? None. So we need to get rid of people who don't have a license to practice medicine. Healthcare needs to be decisions made by the patients and the health professionals who take care of them. We're going to replace this system with Medicare for all.
And it is the position of the national labor movement to get to single payer and universal health care. We are not going to rest until we get there. The Tea Party people are making a big stink right now. They're actually doing us a favor right now by acting as stupid as they are. But it is our position that we are not going to stop until we get to single payer, and we're not going to sit down and do our collective bargaining agreements and just negotiate for health care time and time again. Health care, universal health care, single payer, that's what we have to absolutely stick to. Let us not ever stop our focus. So are we going to continue to stay on the picket line outside these guys that are cheating us? Are we going to continue to march? Are we going to continue to march for single payer?